introduce ourselves. I know I've been talking to you for a little while now, and perhaps haven't introduced myself. So I'm Amin. I'm the engagement manager for NHS Merton. That's a part of the South West London Clinical Commission Group, and I'm joined by my lovely colleague Nisha today. So I'll just let her introduce herself.
Hi everyone, I'm Nisha. Thank you, Amin. So I'm one of the pharmacists that's working in South West London CCG. I have a Merton Borough focus, and I've been working alongside GPs and nurses setting up our GP-led COVID clinics. I should have asked at the beginning, can everyone hear me okay?
Yes.
Yeah.
Yep.
A bit echoey, but it's all right.
If I change it to something slightly different, is that any better?
Nah, I can't hear you now.
That's worse.
No, it's worse.
It might be
Go back to the one I had before.
Yeah.
Is that
Yeah.
okay?
Yeah, that's good.
I think once we mute ourselves as well, it'll be fine. So as we already said, we're just going to show you a short presentation, and then we can go into Q&As. And Dr. Vasa will be joining us at 1 o'clock to answer more of your questions as well. So I will just share my screen now, and then hand over to Nisha. So hopefully you can see it now.
Yeah, lovely. Thanks, Amin. Should we go to the next slide and then Vasa can introduce himself when he comes at 1 o'clock?
Yeah.
Right, so thanks everyone. Thank you so much for attending. Thank you very much for having me. We've got a little bit of background information about the vaccine. We've got some key messages, and I'm going to try and answer some of the questions that we frequently get, just to provide you with a bit of background information, and then it will be over to you. Can I have the next slide, Amin? So there's been a deal of information in the media, a great deal of excitement about the arrival of the vaccine. And unfortunately, that also means there's quite a lot of disinformation that's out there as well. So really the aims of today are to dispel some of those myths. And really, we want to share with you, what we know now, and try and help this build confidence and optimism around the vaccine, which is how we feel around the vaccine. So as I said, I've got some key messages, and I'll answer some frequently asked questions, and then it will be over to you. Next slide, please. So our key messages for you today is, number one, the coronavirus vaccine is safe and effective. It's verified by an independent body that is and the vaccine has been tested in thousands of people, and we know this is what's going to give us the best protection against the virus. Second of all, it's important to note that this is our best strategy, but we do also need to carry on with all the local and national guidance in terms of social distancing, washing our hands, and wearing masks in the appropriate areas. And finally, just to say that the NHS will let you know when it's your turn to have the vaccine, and it's important not to contact the NHS before then. Next slide, please. So the vaccines we're using at the moment are the Pfizer vaccine and the Oxford AstraZeneca vaccine. So as I mentioned, these vaccines like really rigorous tests on safety and efficacy. So between the two of them, they have been tested in over 67,000 people. So you should feel reassured that whichever one you get, it's safe and it's very effective. You may have heard about other vaccines in the media, but we don't have the full information yet on the ones that haven't been approved by the UK. The only thing to say here is that Moderna has been approved by the UK, and we'll be using this one later on in the year. Next slide, please. So why are we using a vaccine? We know that vaccines are a crucial and part of our defense against infectious diseases. What we know is that when enough people get vaccinated, it's much harder for the disease to spread to those people who can't have the vaccine. And we now have quite good data that shows that it is reducing the transmission. Also, getting vaccinated means that you're not only protecting yourself, but also your family, your friends, your colleagues, and the wider community. Vaccines are made to prevent people from getting serious infectious diseases, and that's because it's much safer for your immune system to learn how to fight the illness through vaccination rather than by catching the disease, in this case COVID-19, and then treating it. So the vaccine essentially tricks and teaches your body how to fight off COVID-19 if you were to contract it. Next slide. So who will get the vaccine and when? So at the moment, we are offering the vaccine to those people who we know are at most risk. So they're the people that we know have the most exposure to the disease, and those people that we know are at most likely risk to be sick, get very sick, or die from the disease. And at the minute, we're offering the vaccine in some hospitals, some pharmacies, hundreds of local vaccination centres run by GPs, and larger vaccination centres. More vaccine centres are opening all the time, and this increases our capacity to be able to get through the vaccination groups. So at the moment, we are vaccinating those aged 60 and over, those in the clinically extremely vulnerable group, the clinically vulnerable group, those living in or working in care homes, health and social care workers, and those people who get a carer's allowance. And this list is set out by the Joint Committee on Vaccination and Immunisation. Next slide, please. So how will you know when you can get the vaccine? So when it is your turn in that list, you will receive an invitation to come forward and make a booking. And for most people, this will be a letter, so either from your GP or the national NHS. You may also get a text message or a phone call. So the NHS will let you know when it's your turn to have the vaccine, and letters are being sent out each week. So if you haven't already had your letter, be patient. If it's your turn in the priority group, you'll be contacted soon. Next slide, please. So again, this is a little bit more information as to the priority list. I won't go into that again, as I mentioned who we're vaccinating at the moment. Just a quick note to say that the Pfizer vaccine is licensed in people aged 16 and over, and the AstraZeneca vaccine is licensed in those aged 18 and over. Next slide, please. And in terms of where the vaccine is being administered, so we've got the larger vaccination centres, or the mass vaccination centres, you might know them as, some pharmacies, and some local NHS services, so hospitals and GP surgeries. Next slide, please. So just a note in terms of where you're offered, in terms of the centre, we would say please try to attend the centre that you are offered, and if you can't attend that centre, it might just be that you have to wait a little bit longer to get a vaccine in a more convenient location. But as I said, we're opening up centres all the time, and so this we're finding is becoming an easier process compared to right at the beginning of the rollout. Next slide, please. So can you pay for the vaccine privately or through a pharmacy? So no, just to say that the vaccination is only available through the NHS to eligible groups, and it's free. So if you are ever asked for your banking details or any details relating to financial accounts, then this would be a prompt to suggest that this may be a fraud. So, and no one will turn up to your door unannounced. You will get invited. You will get invited through the NHS, usually through a letter or a phone call. And at the moment, there are no plans to make the vaccine mandatory. I think if we stop the slide there, Amin, hopefully that's a nice introduction, but really, yeah, we wanted to hear from you if you had any particular concerns, questions or experiences that you wanted to share with us.
Would it be okay if we just had a 5-minute break before questions, just to give the interpreters and the captioner a break, and then we'll come back and ask some questions? Is that okay?
Yeah, absolutely.
Yep.
Yeah,
Perfect. So we'll all take a 5-minute break, and then we'll come back and ask some questions. Okay. See you in 5.
Okay, I have loads more questions now because of that presentation.
I'm sure Nisha's
that's
very
often the
excited.
case.
See you all in 5.
Okay. Can I just stay here?
You can just stay here.
Okay.
We can now ask Nisha some of our questions, and then oh God, my pen name blank? What's the GP's name? Sorry,
Dr. Vasa.
He'll join us at 1 p.m. Perfect. So, shall we start and ask Nisha some of our questions? Does anyone want to kick off, or do you want me to start with my list and then?
Start with a really hard one.
I'll just start with the first one on my list, and then if anyone wants to expand on the point I've raised, do so. But it's a point that we discussed in the first 30 minutes. So everyone wanted to hear a little bit more about the long-term side effects of the vaccinations, and the difference between AstraZeneca and the Pfizer vaccine's side effects.
Yeah, I think it's important to be honest, right? Right from the outset, that obviously it's a new vaccine. We've started using it since December. So we've got trial data where we looked at lots of patients. So between the two, there were like 67,000 patients in both trials. And the safety data that we got from those trials was really good. So the side effects reported were really, were mild. So the things that you probably heard about, sore arm, feeling a bit flu-like, a little bit achy, things that tend to go away after a few days. And so that's what the trial data looked at. We also, now that it's being used, we look at the side effects as well. So we've given the vaccination in the UK to over 20 million people, and we carry on looking at the side effects. And what we do is we look at the side effects and we try and figure out whether it's being caused by the vaccine or whether maybe it's just a coincidental side effect. And all of that data that's being looked at as well is also showing that the side effects tend to be quite mild. In terms of long-term data, it's very, I do want to be honest, we clearly don't know about long-term data in the sense that we haven't been using it for that long, but there's nothing to suggest at the moment that it will have any long-term effects. So that's using all the trial data we've got, everything that we've looked at so far. But, I do want to be honest and say, obviously, it is a new vaccine.
Rhiannon.
But there isn't anything that's worrying us at the moment. But I do, appreciate your concerns.
Rhiannon, did you want to follow on about your blood clot point?
Oh yeah. So this new thing about the blood clots being caused, my nan literally just died of one like a few weeks ago. So obviously, with it running in the family like that, I don't feel like it's safe to get it. But on the TV, they're like, oh, it doesn't matter, just carry on like it's nothing. But obviously, it's important because I have family who died from it.
Yeah, I'm really sorry to hear that, Rhiannon. Really sorry for your loss. And it is important. It's obviously a very serious condition. So I think the key thing to say here is, so as I just mentioned, what we do is we look at side effects and we look at severe outcomes from people that have had the vaccine and then have had the severe outcome. And then what we do is we compare that to, well, how many people would normally get the severe outcome in the normal population. So what happens is in the normal population, aside from COVID, aside from the vaccine, which I appreciate is quite difficult to imagine right now, we would expect a certain number of people to get blood clots. And unfortunately, we would expect a certain number of people to die out of a certain number of people. But so as I was saying, we've now vaccinated 20 million people. In the AstraZeneca vaccine, which is the one that's been mentioned in the news in terms of the blood clots, we've given 9.7 million doses of that, and there have been about 40 cases of blood clots in the UK. But actually, we would expect, even in a population that hasn't been vaccinated, we'd actually expect more people to have blood clots. And what that shows is that the blood clots aren't happening because of the vaccination. So it's just really important to keep that in context. And, I probably don't need to tell you, but versus the fact that we do know that 125,000 people have died from COVID. We don't know how many people are suffering from long COVID. And we don't know how many people are impacted economically by the disease. So what we're saying is, although it's a severe outcome, it's not being linked to the vaccine because it's not happening any more than we would normally expect it to.
What about somebody who's prone to, or who could get blood clots more down to being their injury? Because I'm a spinal injury and I could be due for more prone to blood clots. What's the prevention, or what's the percentage of chance of somebody like myself getting it?
Yeah, the advice really isn't any different. The advice really isn't any different. So there've been 40 cases. So compared to the number of people that are being vaccinated, it's a very small number, and so the link just isn't there. So statistically, that link just isn't there between the COVID vaccine and the blood clots. So the advice for yourself or anybody that's got different risk factors in terms of blood clots, we're not advising anything different at the moment. So if you were offered either vaccine, either would be safe for you to have. So just to reiterate, that's based on all the safety data we've got so far on the 20 million people that have been vaccinated, and also in terms of the trial data, we're looking at safety data in 67,000 people. So it's quite a lot of data that we have now, and it's something that obviously we will continue to look at, but the link just isn't there at the moment between blood clots and the vaccine.
Okay.
Thank you. Rahima, following on, did you want to ask your question about women and the side effects?
Yeah, I just wanted to, well, my daughter's concerned about taking the vaccine because she has heard that it can affect women having children in the future. Just
Yeah, no, thank you. Yeah, really good question. I know there's been a bit about that in the media. There isn't anything to suggest that it can affect fertility, and that's because of the way it works. So it's not a live vaccine. So the way it's been engineered, we know that when it gets into the body, it can't go into your cells, it can't replicate, and it can't get to an unborn baby. So because of the way it works, and particularly the fact that it's not a live vaccine, we know that it can't affect fertility. So what the advice is, if you are trying to have a baby and you're offered the vaccine, we would still recommend that you have the vaccine. And if, say, you've had the vaccine and you later find out you're pregnant, not to worry at all, that's completely safe. And that's also backed up by the Royal College of Obstetricians and the Royal College of Gynecologists. They're the experts in this field. They've looked at it and they're not issuing any guidance otherwise. Completely safe in fertility. But yeah, really good, quite important question.
So that goes for all the vaccines then, all the COVID vaccines?
So yes, the two that are in use, absolutely. So the AstraZeneca and the Pfizer vaccine that we're using, neither are live, both are fine and won't affect fertility.
Okay.
I think this was your question, Rianne, about the differences between the two vaccines? Did you want to?
Can't remember.
Can't remember. So I think Rianne wanted, and I think a number of other people in the group mentioned it as well, the difference in the Oxford vaccine and the Pfizer vaccine, and if the Pfizer vaccine was as safe as the Oxford vaccine.
Yeah, absolutely. So again, in the thousands of people that we looked at in terms of safety, the side effects were very similar, and it's probably about what we know now is there's about 1 in 10 people that are affected by these side effects. So the sore arm, feeling a bit achy, and so forth. So side effects are thought to be quite similar. They're both really effective. So even after the first dose, there's slight differences because there's a few different studies that have happened. So there's slight differences in terms of numbers, but both are really good first dose, and to get the full immunity you need the second dose, and after you've had the second dose, both are really good. I would say that in terms of differences, the differences might just be if you have got, say, particular allergies. So if it's helpful, we can share a list of ingredients afterwards. But if you're allergic to, say, something in the Pfizer vaccine, then we'd want to give you the AstraZeneca vaccine. If you're somebody that's got, say, lots of allergies to lots of different drugs, just to be completely on the safe side, we give the AstraZeneca vaccine. So those are really the main differences. The other difference, like I mentioned in the slides, is that the Pfizer vaccine is licensed for people 16 and over. So if you're 16 and you're at risk, you'll get the Pfizer one, whereas AstraZeneca is licensed age 18 and over. But yeah, just to say from a personal experience, I work in the clinics. and I turned up to clinic a few months ago to get my vaccination because obviously I was going to be exposed, and you know, I would have been happy to have either. It just so happened that I had the Pfizer vaccine, but I would have been happy to have either. My parents went to get theirs, fortunately, quite recently, and I just similarly said, whichever one you're offered, you know, please do get it. Unless you've got specific allergic problems, then not to worry, either is fine.
Can I ask a question? What happens if you're pregnant?
Yeah, so the advice is just a little bit different in pregnancy. So obviously there's no reason to think that it would affect the pregnancy. So it's not a live vaccine, so there's no reason to think it would affect a baby. And just to put it in context, we do use lots of vaccines in pregnancy. So pregnant women will be offered the flu vaccine. Pregnant people will get offered the whooping cough vaccination. And similarly, those two are not live vaccines, but we've been using those for a bit longer. The difference is because obviously it's a new vaccine and we're still waiting for more data, and it's quite difficult to obviously test vaccines in pregnant people. So the advice is, for the moment with pregnant people, we're offering it to people who are exposed more, or people who we think are going to be really at risk if they did get the disease. So people that we think really, if they got the disease, they're going to become quite ill. So those are the people we're offering it to. So if you think you're in one of those categories, I'd strongly recommend you discuss it with your GP. But again, from personal experience, obviously I work with quite a lot of people in the clinics and healthcare professionals, and all those that are being exposed to people and are exposed to the virus who are pregnant have had the vaccine, because it does offer that protection. But if that applies to you, I'd discuss that with your GP.
It's not me before anybody thinks it was for someone else.
Rianne had a follow-on question for the Pfizer AstraZeneca question, just as to why there is a difference in age. So I think it's the 16 and the 18.
Yeah, it's just who they tested. It's just who the companies decided to test in. So Pfizer just decided to test in people 16 and over. And so that's where we've got all the information. And that just means the licensing. So because they only tested in people age 16 and over, that's who they're allowed to offer it to. And then AstraZeneca, just a different company, just decided to test in 18 and over. And because they only tested in those groups, they're the people they're allowed to offer it to. So it's a bit of a technicality, really.
Thank you.
What's the percentage between just having the first jab and the second jab? I know you said that you have full protection after the final jab. But after you've had the final jab, even how much more likely are you not to catch COVID?
Yeah, the doses, the percentage of efficacy for the first doses are really good, and that's why we went with the program of getting as many people vaccinated as possible before going on to the second doses. So for Pfizer, it's around, the latest figures show that they're 89% effective. For AstraZeneca, it's 74% effective, and that kicks in about 2 weeks after having the first dose. And then once you get that second dose for Pfizer, that goes up to about 94%, and for AstraZeneca, that's 80%. And just to say that full protection kicks in a week or two after that second dose. So I would say it is really important to have that second dose. When, if you don't get that second dose, it's not going to cause you any harm, but it's really going to give you that full protection. And just to say, you might see different numbers floating about, and that's just because sometimes it's different studies look at different things, and so with those numbers it shows really good efficacy. But also just to say that the numbers for reducing hospitalization are actually much higher. So AstraZeneca's really showed that hospitalization has really gone down if you're getting it, and also there's now a lot of evidence to say that the transmissibility is going down as well. So there's some really, really promising data that's coming out. just to say also, obviously, even after having that first dose and second dose, at the moment, we are carrying on with social distancing and using masks and so forth. But yeah, the data that's coming out is really good, but we would recommend you to have that second dose.
I think
there was one more thing, but I've forgotten what it was. Yeah, it'll probably come back to me on the same point.
It comes back to you
Such
just
a long wait, like up to 12 weeks for the second jab.
Was that sorry? Why is there such a long wait?
Yeah, for the second jab.
Yeah, so that was so that obviously changed to 12 weeks, and that's because obviously in December, you know, I think it's fair to say the UK, you know, we were in quite a bad way. There was just a massive surge of infections. There was a really high mortality rate. Our NHS was really struggling to cope. And what we learned at that point was that first dose did have really good efficacy. So the plan to wait for 12 weeks was to protect as many people as possible. And like the data we have now is, you know, like I said, it's really exciting. It has really shown that it's made an impact, but it was really about making that impact to as many people as possible who we knew were vulnerable before we do the second doses. I think it was frustrating the way it happened. You know, all of us were frustrated the fact that, you know, there was one thing that was said at the beginning and then it was changed to 12 weeks. So I think the change was really frustrating, but I do agree with why it was done. And, you know, we're really starting to see the benefits now. So, you know, you can see now with the population that have been vaccinated, so with the age groups that have been vaccinated, you can see a really clear difference in the mortality from before we were vaccinating to now that we have vaccinated those groups. So I do think it was the right decision, but completely understand the frustration in the change.
Okay.
Thank you. Rianne, did you want to ask your follow-on questions?
Yeah, I was just wondering, is it really reducing hospitalization, or is it just the fact we can't actually go anywhere? So obviously no one's going to catch it, because that's what I think.
Yeah, no, really good question. I know it's hard to, yeah, the fact that we've all been at home obviously has an impact, and that's definitely had like an effect on the R ratio. And that's definitely had an impact, and again, you know, I think that was the right thing to do. But what we can see is from the people that have had the vaccination, so we know that, you know, 90% of people aged say 70 and over, we know that now that they've had the vaccine, that the number of hospitalization and mortality has really gone down in that group, and it's gone down in that group much more than it's gone down in lower age groups, and the lower age groups are the people that haven't had the vaccine. So because of that, you can see that actually it's the effect of the vaccine rather than the lockdown. So lockdown absolutely will have had a really positive effect, but because we can see specifically the data for the people that have had the vaccine, there's a reduction in mortality. It's very clear that that is the vaccine.
Are you sure it's not just because younger people like me, I still go out and do my whole life normal? Is that why it's spreading around us? Like, no, like, you know, sorry guys, my health is more important.
Yeah, it's really difficult. Obviously, we encourage you to adhere to like local and national lockdowns, but yeah, I completely appreciate it. It's really difficult, but yeah, things are changing. It's not long till we're allowed to see people in the garden. But yeah, certainly the evidence is showing that it's because of the vaccine.
Rahima, did you want to ask your question about the different boroughs?
Are the NHS worried about?
After Chris, go on, Chris. You go first.
Are the NHS worried that after we come out of lockdown that it could flare up again, and after the full vaccination of people that are vulnerable in the vulnerable category, how less likely are they to probably get the virus, or would you be able to, once you're vaccinated, still live still be able to be free in the community 100% without having to? I know you have to wear the mask and stuff like that.
Yeah, I mean, so that's obviously certainly Boris's plan. So from June, things start to return to a much more normal, and you know the reason he's announced that is because of the vaccine data. So I think as we come out of lockdown, there is a concern about how the virus will transmit again, for sure. But yeah, as I said, there's a really clear, quite exciting results coming from the trials about the vaccine, about the fact that it is, not only reducing mortality and hospitalization, it is reducing transmission. So I think we feel, it's difficult to say, it is difficult to say with 100% confidence, but everything is going in the right direction. It's hard for me to predict now whether there'll be another resurgence or, another wave. But everything is certainly going in the right direction now, and it's not just because of lockdown. That is because of the vaccine effect. But yeah, difficult to give an answer with 100% confidence on that one.
Thank you. Rahima, would you like to ask your question about the differing of the follow-up vaccination? Yeah.
Yeah, sure. Different viruses seem to act differently. Like Wandsworth, when you've had your first jab, they give you a date for your second jab. Whereas in Merton, I went for my jab and they just told us up to 12 weeks. They'll inform us whether or not they do come back to us for the second jab or not is another thing. But I was just wondering why everyone's operating differently in that way.
So it won't be a borough difference, but there are two different ways in which you can get invited for a vaccine. So one way is through your GP surgery, and Rahima, I'm going to assume you got invited through your GP surgery. Yeah, so you will have been invited to a local vaccination clinic. So I presume you're at the Nelson or the Wilson. Yeah, so in those clinics, what we're doing is we're offering the first injection, and then, like you said, the GP will be in touch, and we have got mechanisms in place that, so from about 10 weeks onwards, you'll get called for your second vaccination. I work at the Wilson. I'm Merton Borough facing, so I know we're all getting ready for those second doses. The second way in which you might get invited is through the national booking system. And if you get invited to the national booking system, you'll get invited to some of the larger centres. So, for example, Hawks Road Centre, the Crystal Palace Stadium, and also some pharmacies. And the national booking system just works slightly differently in that you will get 2 vaccinations booked in. So when you get that invitation, you can book 2 sites. And so there's the 2 ways in which you'll get invited, and those are the differences. But that sounds right, that you haven't had yours yet. But we are all gearing towards second doses, and we've got things in place that you will be invited.
Great. Okay.
Alma, did you want to ask a question at all? No. Alma? No.
No. Thank you.
Rianne, do you want to ask your question that you just put into the chat box?
Oh yeah, the vaccine doesn't protect against variants, so what's the point in rushing to vaccinate people against variants that probably don't even exist anymore?
Yeah, again, really good question. I think first thing, again, just to put it into context, so we have a flu vaccine every year, and it is the way that viruses work. We expect them to mutate, and it's similarly to the flu virus. A flu vaccine mutates, but it doesn't mean that flu vaccine isn't effective. We are looking at and taking seriously some of the new variants really seriously, and scientists are looking at whether the 2 vaccines that we're using are effective with those variants. But what we do know is that the 2 vaccines that we're using are very effective at the most predominant strains. So that's the original UK one, and then if you remember, the one that came about next, which has kind of taken over, is the Kent variation. And so what we know for sure is that the 2 vaccines that we're using are very good at protecting against those 2 strains. So we are looking into it a bit further as to whether they're going to be effective with the South African one and the Brazilian one, but those strains are in the minority. So on balance, the vaccines are very effective against the ones that are circulating most frequently. And if a change did need to be made, so if the different viruses did take over, other strains, then it is quite easy to also change the vaccine as we needed. So next year it might be that we do change the vaccine slightly, but at the moment, like, very happy that the vaccines we're using are going to be effective against the strains that we know are out there.
I think, Nisha, it's important to point out that actually when this vaccine development technology these days, we don't start from naught, we don't start from the very beginning. We have something, I normally say to people, it's a bit like the train is already in the platform. All it requires is a minor adjustment and it takes off, because the basic ingredients are already known. So it's a bit like a cake, I would say. You already know the milk and the flour and the sugar, and what else you put into a cake is already there. Then if someone wants a flavor of caramel or flavor of chocolate or carrot, that comes in at the last minute. That's really how simplified vaccine development now is. The platform is already there. You get the genetic code, you plug it in, and off you go. And that's what they did in April last year, and that's what we can do if there is a significant change in the variations. And our hope is that if we can get the whole world done as soon as we can, then there's less risk of replication and variants coming to affect us. But remember, the annual winter flu campaign, every year they give us a new variant to deal with. So this variant is nothing new for us in the world of virology and in the world of immunization. It's just that it gets the headlines, because you know what, nothing much is going on in the world these days. So the headlines always have to be COVID. So come the summer, when other things start happening, you know what, we'll be getting on with our lives, because all adults in UK would be immunized by then. And then we'll have less of these stories for the media to highlight. At the moment, this is the only story in town.
This and Meghan Markle, I think. Meghan Markle dominated a few headlines recently, didn't she?
Another question that was raised a little earlier was, what is actually the difference between the flu jab and the COVID jab?
It's a very interesting question, actually, because there are two. If you look at these vaccines we got at the moment, we have the mRNA one, and then we had the modified, the AstraZeneca technology. Can we talk, Nisha, can we separate it like that in simple terms? The modified viral one and the mRNA one. The modified viral one and the traditional flu vaccines, to me, there isn't much difference in technological terms. They all go back to the basic thing of provoking an immune response. Is that what you would say too, Nisha?
Yeah, just they're ever so slightly different. So the Pfizer one is an mRNA, what we call an mRNA technology, and the AstraZeneca one is what we called an adenovirus. So it's a modified virus. But as Vasa said, they're both designed in the same way. So when they get into your body, it's going to cause your body to make the spike protein from the virus, and that makes your body produce an immune response. And I mean, you know, you can forget all that if you want. The important bit is it teaches your body how to fight the disease. So if you were going to get coronavirus, your body will be ready, compared to if you didn't have it. So it's much less likely that you're going to get a severe illness.
Okay.
But is it true that the you've already said that the COVID vaccinations are not live, but what about the flu? I heard the flu one is live.
So if you look at the flu one, there are different versions. One is the version we put into the arm, and then there is the version we spray in the nose. Yeah. So we do not give live vaccines to pregnant mothers. That is our rule. But we do give the flu vaccine to pregnant mothers every year. We do. Yeah. Okay. Yeah. So that is where we talk about the live and the inactivated ones. Yeah. So we certainly never give live to anyone who is pregnant. So this vaccine, because it's not live, we give people who are pregnant. The intramuscular flu, we give pregnant moms because that is not live.
Okay.
I suppose just while we're on the subject of how the vaccine works, just to say, you know, you might have heard things about it affecting your DNA, but the way it works is it cannot get into your cell and replicate your DNA. That's just not possible from the vaccine.
I heard it can track you.
Say that again, Ria.
What was that? Sorry.
I've heard rumors about it like tracking you.
No, I mean, so Vasa and you know, I've worked in clinics. I mean, we can share a slide of all the ingredients, and just to say that, you know, it's an independent group of experts that verify all of that. You know, it's not a scientist in a back room that's making lots of money. You know, it's an independent group of people that verify what exactly goes into the vaccine. I've been there in clinics, I've been diluting it. You know, there's no chip in there, there's nothing that's going to track you. And certainly I think if people wanted to track us, I think our phones do a much better job than any vaccine would do.
So certainly there is no material, there is liquid. And you know what? You've got to put a needle into there, and you've got to take 0.3 mils of the Pfizer, 0.5 mils of the AstraZeneca. It's hard work. The pharmacists don't let me in there because they don't trust my eyesight, even when I wear my glasses, because they have to accurately take that little bit out there, and they are putting a needle in there. It's a small needle. So there's no way there can be any material apart from that liquid which comes out there. So I'm absolutely confident. In fact, they don't even allow us to shake that Pfizer one. They have a dance. Nisha, you know the dance they perform. They perform a dance with that. They don't shake the one like that because it'll damage the spike protein. So they do a little bit of a dance and a wave. But get a video of that, Aman. Watch a pharmacist doing that dance with that, because that tells you how delicate that vial is with the Pfizer vaccine. So it's amazing stuff. There's certainly nothing there. It's liquid material. I've seen it too often in the vial being aspirated into very small needle, very small syringe, because you've got to count that 0.3 mils of that vaccine, and every drop counts. We can't waste it. You see, we have to give it to the people, not put it in the bin. So it's a very accurate process. That's why I'm banned from the aspiration room in the Nelson and Wilson Hospital.
Mate,
we're told to.
I wish he was my doctor.
I was just going to add, we're told to treat the vaccine as if it's a lover or a partner. We're told to treat it as if, you know, with great caution and care.
Rhian, do you want to ask the question you just put into the chat?
Oh yeah, because I have to go in a minute. But I just wanted to ask just two things. First of all is, what is the point of me getting the COVID vaccine when I've already had COVID and so obviously I have the same protection? And the other one is, why do they keep saying I'm protecting others by getting the vaccine when I can still pass it on? So actually I'm only protecting myself.
Okay, good question. I like it. It's a question which I think we answered carefully. Right. First point, you did have COVID. You did develop antibodies, but the problem you got is you don't know how long those antibodies are going to last in your body and how effective they are going to be to protect you from the virus if it was to come again. So if you knew the answers to those two questions, then you can say, I don't need the vaccine. But because you don't know how long it's going to last and how good it's going to be to protect you, sadly, you need the help of the vaccine to keep it up. It's a bit like putting money in the bank to keep the money at the same level. Otherwise, it starts going down with time and suddenly there's no money there and you're in the red. So it's a bit like that, just as a top up. And you know what, with COVID, I won't take any chances. I can't wait till I find I've gone too low to get COVID to realize I needed the top up. So better plan ahead and get the vaccine to stay at the right protection level. Having antibodies alone is not enough. It has to be at a level high enough to be protected. Does that answer the question?
Yeah.
Right. Second question. Second question was others. Okay. It's a very important question. You're quite right. Just because I took the vaccine doesn't mean I'm going to 100% protect other people from getting it. But this is not about everybody. Just think of it. Just think of me. If I got COVID, I hope my wife will look after me. So I will give it to her. Okay, first point. Second point, if I fall ill, the paramedic has to come home and take me to hospital. I can give it to her. Third point, when I go to hospital, the nurse, the therapist, the pharmacist, the doctor, the porter, the cleaner, all the hardworking people there can get it from me if I get bad COVID, yeah? So really, if I just take the vaccine and not get it, my wife will be happy, and that will be an achievement. The porter will be happy, the cleaner will be happy, the doctor will be happy, the nurse will be happy. So by taking the vaccine, actually, by not getting bad COVID, I'm actually preventing other people getting it from me. And I think that is the simple way of me looking at it. To say, yes, I do it for myself, but I also do it for others. I think that's important to remember. That's why I stored it like a story rather than giving you science and all those numbers games other people give you sometimes.
Thank you.
Thanks.
Jolanta, you're on mute. I can see you're speaking, but you're on mute. After Jolanta asks her question, we'll have a short break and then come back and finish off with the last few questions I've got listed.
Aman, did you hear from Wideway yet?
No, but maybe Dr. Vasa actually can answer that question.
What's the question?
Do you want to give him a bit of an update, Rianne?
Oh, so me and my family, we keep being harassed by Wideway about getting the vaccine, but we don't even go to that doctors. We go to Morden, and my sister goes to Cricket Green. So I don't understand why they keep texting us.
Right. So did you change doctors recently or you changed doctors long ago?
No, I've been at Morden Hall Medical Centre for like 10, 11 years.
Oh, okay. So that means that's a computer glitch. So when you move from one practice to another practice, you should, once you sign the papers in Morden Hall, the NHS computer system should have put you at Morden Hall and taken you off the list in Wideway.
We've never been to Wideway. We don't live anywhere near it.
Ah, that's even more of a mystery.
But they keep sending us loads of messages.
Okay, in that case, and you have told them that you're registered there, or
we haven't contacted them. We're kind of just ignoring them.
Okay.
Because we didn't want the vaccine.
So I rather they contact their patients who haven't had the vaccine rather than spend their time contacting you. So Aman, with Rianne's permission, can we actually give Wideway the names of 3 people whom they can not contact, and they can contact 3 others?
Yeah.
Yep. Brilliant.
Absolutely.
Thank you. So we will help you. It's a computer error. I won't blame them, but I don't know how they got your name though. That's surprising. You never lived there ever, even when you were little.
No, I used to live in Sutton.
Oh, okay. No idea. But anyway, we'll put that right for you because I really don't want them to waste your time, and I also don't want them to waste their time. They've got work to do. So we'll tell them to find their own patients to chase.
Okay, thanks.
You're welcome.
Jolanta, do you want to ask your question quickly, and then we'll have a break?
Yeah. Okay, then thanks. I had COVID. My mom had COVID. Some people in the family had it. Now, is it safe to get the vaccination? I had this COVID like 4 months ago, and I still suffer from it. And my mom had it like a week or 5 days ago, and she was ill. And from what we can hear, people who did not have COVID, they are okay. And this was this Pfizer vaccination. But those who had COVID, they suffer from the injection, and apparently it's even worse to get the second injection, which is like due on the 20th of April, I think. So how long do I have the antibodies? Is it because they're sending me messages to come for the vaccination? Obviously, I cannot do it now, but then, there are different perspectives on how long the antibodies are staying in you. It's 3 months, 6 months, 8 months. So how long is likely to have those antibodies? Because it looks like that if you have the antibodies and you get the injection soon after you had COVID, you can get ill.
Good question.
No.
I'll tell you, good questions are complicated and do not have a yes and no answer. So let me give you an answer. So once you have COVID, what we normally say is wait 28 days before you have your vaccine. You wait enough time to recover, okay? Because yes, you develop antibodies, but as I said to Rianne before, we don't know how strong the antibodies are going to be and how long they are going to be effective. Having antibodies by themselves doesn't mean anything. They have to be at a protective level, and we can't guarantee that they are going to be at a protective level for 3 months or 6 months or 9 months, because we don't know at the moment enough data, because there's no point talking about other people. For you as a person, we can't guarantee to you that after 3 months or 2 months or 6 months, you are safe or unsafe. So because we don't know, we are being cautious, and we say after 28 days, you can have the vaccine. But there's a but in this, but If you are still suffering, if you're still not well, then we don't routinely say, come and have the vaccine. We say, first come for a chat. Talk to us. Tell us what the issue is. So the issue is breathlessness, or the issue is palpitations, or the issue is dizziness, or the issue is whatever it may be. Then we say, hang on a minute, you are probably suffering long COVID now. So let's talk about it properly and then decide. But just because someone has long COVID, that is COVID for more than 12 weeks, we still say to them, consider the vaccine. We don't say to them, don't have it, because you know why? Just imagine if you're suffering long COVID after the first infection, what happens if you get a second one? It's going to hit you even harder. So it's always comparing the two, the risk of getting the virus again or protecting yourself from getting the virus. But if your mom's recovering or you are recovering, talk to your doctor. Don't get put off by what you read from your friends.
Yeah, I'm going to do
talk
it.
to your doctor, please. I have lots of conversations on this topic with my patients, because you got to know, ask the question, what is the suffering? What is it about? And then you can answer it better and people can make up their own minds. We don't push you into it. We talk about it and let you decide. But if you're feeling unwell, the last thing is I want to vaccinate you. If you're feeling unwell and I vaccinate you, then if you get ill, then it's not good for you. It makes you unhappy about it. It doesn't harm you too much, but still makes you unhappy about it. And why should we cause unhappiness? We are here to cause protection. We are here to make you feel better, not to make you feel bad. It's never our intent. So please speak to your doctor.
Okay, then I'm going to do it tomorrow. Thank you.
Please don't believe the stories that just because you have the infection, you don't need the injection. Not true. Okay, not true.
And one more question, please. How is
Jolanta,
the length?
Jolanta, could you ask it just after we have a short break?
That's
just
fine.
because,
Okay.
Yeah,
Sorry.
if you can just remember it.
Time to, yeah.
I won't go away, so no problem.
You're still gonna. So if we could just take a 5-minute break, if that's okay with everybody,
that's fine.
just to give the interpreters and the captioner a break, and then we'll come back at around 1:30, and then we'll finish with the questions. Thanks, everybody. See you in 5.
Okay, he had Pfizer jab vaccination, and my mom had this Pfizer, and it says here, when I'm here in Poland now, that in between, if you have Pfizer vaccination, at the most you can wait for another dose 42 days, and my friend had it much earlier than my mom, and he will have another dose in June. So how does it really work? I mean, like, would it be valid if he had it like after more than 42 days? Because the other one is 84 days. I think this AstraZeneca or the other one, I don't know.
So 84 days is 12 weeks, yeah?
Yeah.
So this is happening across the whole world, that there are, the second dose is being given at various time limits. And I always say this depends on the situation in the country, which allows the policymakers to decide, get the most amount of benefit for the most number of people in the country. What is the right idea? What is the right plan? So the plan in England was devised to suit England's situation. England was in crisis. Nobody can deny that after Christmas, England was in crisis. The number of people sadly being admitted, suffering, and even dying in the hospitals in January. Now that was the fact. That is not a news item. That if you call it a news item, then that's very sad, because we know it was a fact. We know of patients. I know of patients whom I lost in January. So for me, the fact that January was a bad month. So was April last year, another bad month in my life. So, and many bad months in between. Based on that, we had to have a policy. How can we ensure that we save the most number of people from dying or needing oxygen or needing ventilation and really suffering? And therefore, we decided in England, the scientists, let's be clear, not the politicians, but the scientists in England then recommended that we make 12 weeks. Because if we made it 12 weeks, we could give the most number of people the first dose. And you know what? We have done it. We are now given more than 22 million people the first dose.
I know, but here is 6 weeks, the maximum with the Pfizer.
No, that's the thing. So if you keep the maximum 6 weeks, you couldn't have given the first dose to 22 million people like we did. I'm happy that there are more than 22 million people in England who have had one dose, rather than follow the Poland plan or the Canadian plan or somebody else's plan, we would not be sitting here today saying more than 22 million have had the first dose. It would be less number, because if we give the second dose too soon, we wouldn't have had enough to give the 22 million the first one.
Yeah, I understand, but they suffer here as well from not enough vaccination, and still they give it like after 6 weeks. So
this is the problem.
And
for the people, you see, the people suffer when leadership doesn't take decisions which help people. In UK, scientists and the government made the right decision to go for 12 weeks so that the death rate in England would come down. And now we are doing second doses. And now we are done, I think, nearly 2 million second doses. And at the moment, we are running both the tracks very well. And I'm happy that we were able to get this number of people, the first dose, so soon. Like we started mid-December, and now we are in mid-March, and we are saying nearly half the country is done. So it is only possible because we changed our policy.
And what like, because they're calling me now, obviously I'm stuck here. Several times I've been called to come for the vaccination. And what vaccination I would be offered? Is it AstraZeneca or Pfizer in the UK?
So it's difficult to say, because you know what, if I went now to our vaccine center now, what is in the fridge, that's what I will get, because,
I see, okay.
Because it's about the supply. So did you say you were in Poland at the moment?
Yeah, at the moment I'm in Poland, yes. But I live in the UK.
Yeah, it happened to me the other day. I spoke to a patient and she told me that she was in Portugal. I thought she was from the corner in my practice. I said, you haven't come for the vaccine. Yes, I'm in Portugal. There you are. So we all know a lot of patients who are not in Merton or Sutton at the moment. When you come back, please let us know. Unless you've already been vaccinated over there, then do let us know, because you mustn't.
Yeah, I know, because a long time ago they called me from St. Thomas Hospital. Now they're calling me to Nelson Hospital, and I've been trying to call them, but it's not possible to get through. Yeah, but I told St. Thomas.
We'll take you off our books. We'll keep you on our books. So because we keep you on our books, we'll keep calling you, because you keep appearing. We do a lot of searches. Every week we search who is over 70, who is over 60, who is over 55 and not vaccinated. And then I get a list from the people who boss me in my practice, tell me, call these 10 people. That's your job for the day. Well, in addition to my normal job. Then I call those 10 people, and then I spoke to the lady in Portugal, you see. Anyway, she's still on the book, so she may get a call next month from me, and she'll still be in Portugal, but I'll still call her because I won't take a chance.
Yes, I understand, but I called St. Thomas Hospital and they told me no problem. When I am back, then to give them the call.
Yeah. Don't be upset if they call you again, because the person you spoke to may have gone for a cup of tea, and then somebody will see your name and number and call you, thinking.
No. It's the GP who keeps calling me, and they know I am away.
Sometimes we make last-minute phone calls when we have got about 10 vaccines left, and we think, shall we call this one? She lives around the corner. She may come in a hurry without much delay. Unfortunately, that you are in Poland, so you can't come in a hurry with 10 minutes notice. But come back soon I think we are going to be a very safe country in a few months with all adults immunized. So I think you'll come back quicker here.
And would you know, like, if my mom will come with me to Poland and she will have the certificate of the vaccination, would she still have to make the the test, COVID test?
No, we don't test to vaccinate. If people are vaccinated, we take it that they have immune. We do not do antibody testing to prove that they have had the vaccine. So if she has a vaccine certificate and she shows it to a GP, I will mark in my notes that you have been vaccinated in Poland, and then we won't give you the 2 vaccines here, because there's no need for that.
No, you don't understand, because I can't have it. I didn't achieve the age to have it in Poland, so I'm not qualified here. What I'm trying to ask, whether you know, if my mom comes and she has got 2 injections, would she still have, coming to the UK, would she still have to do the COVID test, although having that certificate of the vaccination?
That's a Home Office question. I don't know what the rules are in the Home Office when people come to England about this quarantine question. Honestly, I had not even looked into that. But how can we find out? If someone travels to UK from abroad, British quarantine rules apply. 14 days of isolation or something?
10
Yeah,
days. I
that's
think.
right. Yeah.
Don't know now. Okay, then thank you.
One of the questions that we had earlier when we was having the discussion is that if I don't get the vaccine, can I still go on holiday?
Good question. So that will depend on what rules the host countries will make for themselves. So I have heard that Cyprus and Turkey are quite happy to accept British tourists this summer because they know by the time August comes, July, August comes, all adults in the UK would be vaccinated. So if a country says they will only welcome vaccinated people, then in UK we can't do anything about it. And my concern is exactly that not the governments, private companies, airlines, tour operators, if they start making rules, then I don't want anyone to suffer. So that's another reason. If you want not only holidays, what about if you want to go to a music event, or what do you want if you want to go to a dance club, or whatever you want to go wherever? I don't do music or dance, so I'm all right. But others, but I go to hospitals, so I have to take a vaccine anyway because it's patients. But I'm saying seriously, hobby or work, I don't want you to miss out because you didn't have a vaccine.
Yeah. Thank you. Is there a high likelihood of me contracting coronavirus after I've had the vaccination? But I think you've answered that question by saying...
No, you cannot get COVID infection just because you had immunization. That's evidence, statistics of all the stuff we have done so far tells us no. Your risk of severe disease is reduced. Your ability to transmit disease is reduced. So no, the injection cannot give you the illness. No.
Okay, thank you. And another point that was raised when we were discussing the questions before was clarifying the protocol that was in place, because it feels as though the vaccine was rushed through.
Good question. I dispute the word rush. I will accept the word it was done very quickly, but quickly doesn't mean it's rushed. The word rush has got a meaning to it. It sort of implies shortcuts might have been taken. It might imply the rules were broken. No. We know England, okay? England applies every single rule possible. And the MHRA follows every single rule. So the MHRA, the people who give the certificate, approval, to say, go ahead, they won't approve anything unless the rules were followed. So you asked me the other question. So how come this was done fast? Not rushed, but fast. The answer is very simple. Normally, when something comes along, the people who make the vaccine have to write a business case. They have to write pages and pages asking for money. Then they have to seek approval. Then they have to start the lab. They have to find the staff, find the money. Then they want 2 million. They normally have 1.5 million. Then they struggle, scrape to find the extra little money they need. Then their staff start a project and get a job somewhere else. And the story goes on and on. You want to recruit 10,000 people. It's such hard work to find 10,000 people to come on a trial. What happened this time? Because of the scientists had already worked on Ebola, on MERS, SARS, all these viruses came in the Far East over the last 10 years. They had already learned to make the vaccine. So they already had this thing developed in Oxford, in Jenner Institute, where they had this thing all set up. The moment they knew the code, the exact, shall we say, the characteristics of the COVID-19 virus, they just put the code into the thing they already made up, and then they were able to make this particular one for this particular virus. And also the governments put a lot of money into this virus. Money was not an issue. They were given the money they needed. They could stop all the other projects and concentrate on this. The government said, we'll buy it. We'll buy millions of the vaccine, so just go and produce it. The people volunteered. Never forget the people. It's not the scientists alone, it's the people. The people volunteered to have the vaccine, not in December, but in April, May, June, and July. The brave people who signed up to take the vaccine as volunteers in the experimental studies, the trials, and thousands of them. Because they did all that so fast, we were able to get here. But we didn't start from zero. We already had a flying start because the scientists were very sad when Ebola happened and people died in Africa. The scientists were very, very sad that we didn't do enough. We lost about 12,000 people there. That was too much for us. So that is why we already prepared and waiting, knowing something's going to happen. When it happens, let's get the vaccine. And that's why this happened so fast. So it was not rushed, it was done fast.
Okay, Thank you. Another question that we had is, why are BAME individuals now a priority group to get the vaccination more than other races?
So it all goes back to the data. So if you analyze the data of the deaths which happened in April last year and thereafter, the data tells you two important things. One, if you're over 70, regardless of ethnicity, you suffered a lot. Second, it tells you that if you are from the Black and minority ethnic communities, you also suffered a lot. Now, the facts we know, people from minority ethnic communities are more likely to have diabetes. They are more likely to have heart disease. They are more likely to have kidney disease, sad fact of life. Therefore, it's not the color of the skin which actually makes you more liable. It is the diseases which unfortunately the community suffers out of proportion. That is what is putting the community at risk. And that is why we say over 70 people from Black and minority communities, definitely we are not targeting you because we don't like you. We are only asking you to take the vaccine because we know that you suffer more, but everybody suffers. And that's why we give it to everybody. Because we can't say just because someone is not from the minority community, they're not going to suffer. No, we have seen enough and more suffering across all the communities. So I would say all the communities should get the vaccine. But because we know over 70 and the Black and minority community people also died in higher numbers, that's why we say please take the vaccine, but ask the questions. If you've got any doubts, any concerns, ask your doctor. You have known your doctor before COVID came. You will know your doctor after COVID goes away. So ask your doctor to explain stuff to you if you have any doubts or issues about it.
Thank you. One of the other questions that we had is that if people are scared or have access issues, is there private rooms for vaccinations at surgeries or at vaccination sites around the borough?
Yeah, so people who are scared, we have this sometimes, people are scared, and yes, in the Nelson, definitely there are private rooms in the sense that there are some vaccination rooms where there's only one person. There are some rooms where there's a screen and there are two people in the room. So if you need privacy, we can organize that. Same in the Wilson, we can move people around to a different part if we have to. So communicate, talk, ask, and we will do what we can. Fiona White, have you met Fiona White? I think she did come and join you in the previous meeting. No, I think you need to invite Fiona White to your next meeting, because Fiona White, she also sometimes, for a reason, not for the fun of it, for a reason, she even will immunize you in the car. Because if you're scared to get out of the car and you don't want to come into the hospital premises, but you're happy to show her your arm in the car, she'll do it there with reason. Otherwise, everybody will want it in the car park. But no. So there you are. Just find out, and we'll do what we can. Yes, if you're housebound, we'll come to your house. And sometimes I'm in the process of working out some patients. They said to me, I'm scared to go to the vaccine site, but can I come to your surgery? We don't have the provision at the moment, but I'm asking the home visit team whether they can give me the last 2 bits of the vial so that I can use that for someone who will never go anywhere else but says he'll come to the surgery. So we're trying to help people to solve the problem. Because it's in our, we really don't want people to suffer just because they had access issues. But there is good wheelchair access in both sites. Okay, definitely, it's not a problem. And if you have visual impairment, you just notify the volunteer, and we will sort it out for you.
And if people are housebound, are home visits offered to people?
Yeah, I have been on my home visit myself and I given vaccine. But at the moment, the clinical pharmacist in our practice, he seems to like it, so he has stopped me doing home visits. He's doing the home visits for my patients now. So I'm not allowed to go around Merton anymore.
Thank you. I think that was the last question on my list. There was a question that Rianne mentioned earlier, but it wasn't really a question, and I'm not sure if I'm going to articulate it in the way that she wanted, but it was about a policy that was brought in to say there was no accountability around the effects of the vaccine. And she wanted to hear a little bit more about this because that had affected her trust in regards to the vaccine.
Yeah, these are what I call the legalisms of the business of the world, business part of the world. So the drug companies got this from the government, because what the government said was the government will take the responsibility, not the drug company, because what we didn't want was drug companies so scared to do something which will delay the process. So that is why they got this certification. But for me, it is the MHRA which actually tells me whether something is safe or not. Just because there is an intermediate certificate or not doesn't really bother me at all. The MHRA is an organization which is not going to sacrifice its reputation for anybody, for any government, for any purpose, and I trust them, and therefore, to me, I look at the MHRA. If they say something, they have looked in the evidence, they're happy with that, I'll go with them.
Okay, thank you. I think I've asked all the questions that we discussed at the beginning. So does anyone else have any other questions that you want to ask?
Yes, one more question again. In England or UK with this AstraZeneca, because from what I've read online, that they are very much pro, not against this AstraZeneca vaccination. But so why is it that England thinks that AstraZeneca is safe and other countries, they stop AstraZeneca vaccination?
Good question. So if you look at England, we follow what MHRA says. Now in Europe, the equivalent organization to MHRA is the European Medicines Authority. Now they are also not saying AstraZeneca is unsafe. So the two regulatory organizations for UK and Europe are actually saying the same thing. They're not saying there is proof that AstraZeneca caused the clot.
The blood clot.
Individual countries are making up their mind and suspending their program. Now, my opinion, at the moment, there is not enough evidence to say the vaccine caused the clots, because clots happen anyway. Clots happen in women more than it happens in men. Clots happen in pregnant women more than it happens in non-pregnant.
I understand, but to logically thinking, it must have been a higher number of the blood clots that they decided. They think. Sorry, because my phone, I have to plug in. Gosh.
Yeah. If it is a higher number, I will accept it. But it wasn't a higher number. It was what they are saying is what normally happens happened. So, because when you give 20+ million vaccines like we have done in England, about half of them, so let's say 11 million we are given AstraZeneca. Obviously, if you give 11 million people injections, some of them were always going to get a clot, because clot happened. For the last 30 years, I've been a doctor. Every year, I'll see someone with a clot without the vaccine. So clots happen anyway. That is why we are saying this is not what we call causation. We say this is coincidence. But we keep an open mind. We keep an open mind. We are still looking for data, and at the moment, the British data is very clear. This is not causation. This is coincidence. Nisha, what's the latest on MHRA, European Medical Agency? I think the latest still is there's no proof that it is caused.
Yeah, we were chatting about this at the start as well a little bit, but yeah, exactly what you said. So in total in the UK, there've been 40 clots, and as you're saying, Vasa, we've given AstraZeneca in about 10 million people, and so the 40 clots that we've had are the clots that we would or normally see in the population as well. So that means there's no link to the AstraZeneca vaccine at all. That they're the same numbers that we would expect to see anyway, even in a group of people that didn't have the vaccine. So there's no link to the vaccine. So that's why we've carried on using it.
Thank you. So we've got 5 minutes left. Are there any final questions?
Can I ask a question regarding the COVID?
Sorry, who's?
It's me, Rahima.
Oh, Rahima, go, and then Chris. I think you spoke as well, didn't you? Do you want to go after Rahima?
Oh, right. Yeah, I just wanted to have clarification regarding the COVID vaccine. Would we have to take it every year? And if so, would it be 2 vaccines we take every year?
Yet another question. I get asked this everywhere I go, because at the moment we don't know, but we really think that's going to be the situation for 2 reasons. One, we cannot say antibodies last forever. Two, we know variations are happening. Therefore, it's logical and sensible to have a booster every year to what is going to be the virus we need protection from. So I think I'm working in my head. Yes, it's going to happen. We are going to have a booster, but not the same vaccine. The booster has to be for the enemy we need to protect. We need protection from.
So it'd be just one vaccine a year.
Yeah. Boosters are not two generally, because generally your body has already learned to put up a fight. So a little bit is enough, because same with the flu vaccine. We only give one flu vaccine, don't we? So I think that is the way I think in my head. Yes.
Yeah. Okay.
Thank you. Chris, do you want to go now?
Yeah, how can people or clients get their PAs and carers vaccination, get the vaccination?
So,
do they have to be regulars, or some people have them changing on a regular basis, sometimes every couple of weeks or 3 weeks? Can they get all of their clients?
Chris, you can go online. If you got a PA and if they're able to go online, they can go online and book their vaccine. They won't ask your name. They just have to certify they are on the online site that they are your main care provider. Yeah.
Yeah, well, that's what I'm saying. Some people have them change on a regular, because obviously they might have different people coming to them, and then plus they might be from Eastern Europe or other countries.
It's fine. We have no problem with where they come from and who they are and how many they are. If you got 5 people who look after you, you need all 5 of them protected, because end of the day, that's your right, and that is their right as well. So it's don't worry. If you got more than one person who is looking after you, there you are then.
So not to GP online.
Online, not through GPs can help if you wanted to, but now I say to people, why are you waiting for your GP? Just go online, because the national Charlotte, do you have the link for that? How people go to the Department of Health website and COVID vaccination website, and you just have to put your name and I don't know what they ask even, but I don't think they don't ask you who is the patient's name and who is the GP. They don't, because all they require is that you sign, say that you are more than 50 or 55, or that you are a carer. I can Google that.
I'll find the link. I don't have it to hand at the moment, but I'll find it and I can send it around.
Chris, you made a good point. You asked about nationality. Nationality doesn't matter. Passport doesn't matter. Visa doesn't matter. Anybody, homeless person, asylum seeker, new immigrant, old immigrant, whatever, doesn't matter. We don't ask any of those questions. We don't. We just allow you to get your vaccine. Full stop.
Am I from Eastern Europe? Been living in the UK for nearly 30 years. My question is. Yeah.
We don't ask questions. We do.
Yeah, and I used to live with English people. That's why I stayed in the UK. You know, I was just among the only English people, middle class. Yeah. Yeah.
No.
Okay. Any final questions? Any more final questions?
No.
No. All finished.
Yeah. Please inform your PA, Chris. Please inform your PA that they can go online. Okay, no questions asked. The Home Office will not know, and the income tax man won't know, the police won't know, and Dr. Vasa also won't know.
Okay, thank you very much.
Yeah.
Okay, well, thank you ever so much for coming along and answering everybody's questions today. It's been really useful.
Actually, sorry, one more. If my mother had like what the doctor thinks, she had the flu jab, then soon after she developed the COVID, would it protected her that she had the flu jab? She went, she was very ill for 1 week, high temperature, and she's 78, but she doesn't have any like extra, different illnesses. So did flu jab prevented?
The flu jab she was given will protect her from the flu, because moment you give it in the arm, the body starts the antibody mechanism production.
Okay, then.
So she would have it. But good news, winter 2020, we didn't have anyone suffering from flu, serious flu. Very few people had flu this winter. And I never really admitted anyone. Now, every winter, I normally admit people to hospital. This winter, I didn't make a single flu admission, because everybody is wearing a mask, keeping a distance, washing their hand, and not sneezing on each other. So I'm hoping next winter also, we are looking after ourselves, and we can behave differently in the winter months so that we don't spread flu around like we always did in England for the last 30 years I've been around here.
Okay then, thank you.
Thank you.
Charlotte, can I just ask one more, please?
Yeah, go for it.
A friend of mine had COVID with no symptoms. Her daughter had it little, and her husband sorely died from it. But he was on a ventilator. If somebody ends up on a ventilator, is it actually medication that you can get them through it, or is it down to the person? Obviously, you not knowing whether they can pull through, it's down to the person that's actually got it.
No, there are medications used for people who are severely ill, and those who are on the ventilator are severely ill. And you don't give up hope. You hope that people will pull through, but whether people pull through or not also depends on how fit their body was before they fell ill. So that's why not everybody makes it. But remember, compared to April, in January, the results are much better. So a lot of people are surviving for longer periods in hospital, fighting back, and our survival rates now are better than they were in April. So I never give up, and I always hope the body will recover. But it all depends on your viral load, how your body produced the antibodies, and also whether you've got other underlying conditions. All that put together, that decides in the end. Yeah.
And the longer COVID, how long do you see somebody lasting in someone long COVID?
Difficult one. We don't know. We know that long COVID starts after 12 weeks, because till 12 weeks we don't say it's long COVID. But go back to people with chronic fatigue syndrome. So there are people, I've got patients, I don't know whether anyone in the group, but don't put your hand up, but there are people with chronic fatigue syndrome after glandular fever or some other virus. Some of them have chronic syndrome for years and years, 5 years, 10 years, 15 years. So we don't know, because it's an immunological thing. So we know it happens with other viruses. We definitely know about 5% of people get long COVID. So we know that's happening as well. And we are setting up clinics to look after people with long COVID. So anyone got long COVID, you talk to your doctor, because the clinics are being set up where we can try and help people deal with their problems. Because when we say long COVID, be careful. It's not like one condition. Some people's long COVID affects their heart. Some people it affects their lungs. Some people it affects their sleep. Some people it affects their aches and pains, headaches, palpitations, breathlessness, lots of different things. So it's not like one disease. So seek help is my answer. If you've got long COVID, there are a lot of supportive systems being set up as we speak to look after this. How long it lasts, we just don't know. But that's one reason to take the vaccine.
Is it similar if you had the flu and it's like having what's it called?
Chronic fatigue syndrome.
It's gone. Now, after the flu, some people get pneumonia. It's similar to that, is it? If somebody gets the flu but could catch pneumonia,
yes, you're quite right. So when in the winter months, I tell my patients, some of them need to have the flu vaccine. Others, I tell them they must have the flu vaccine and the pneumonia vaccine. That pneumonia is called streptococcus pneumonia. So we normally say streptococcus vaccine. That is a bacterial pneumonia, whereas the flu pneumonia is a viral pneumonia. Yes, quite right. Anyone over 65 definitely needs to have the streptococcus vaccine as well, in addition to the winter flu every year.
But
the streptococcus is not every year. That's remember. Yeah.
Okay.
I get a complaint, Chris. Sometimes some man will say, you gave my wife 2, you only gave me 1. And I said, no, that's because you already had your streptococcus. Leave her alone. She's entitled to 2.
Okay, thank you. Thank you, everybody, for today. Thank you to Dr. Vasa, Nisha, and Aman for coming along today and answering everybody's questions. As mentioned at the beginning, this event this session was recorded, so we'll be able to share it with you all, so you can refer back to it if you can't remember a response to one of your questions today.
Charlotte, you never told me that. I would have not cracked all my silly jokes. I would have been.
Oh, sorry, you missed it because you weren't here at the beginning. But yeah,
I would have sat up straight and been a proper doctor, not joking away.
It's on the record for everybody to see now. But yeah, thank you everybody for coming along today. I'm sorry we've overrun by a few minutes, but yeah, thank you everybody.
Sandra, Charlotte. Hello, Charlotte.
Yeah.